everyone, and welcome back to another episode of Making a Difference in Mental Health. I'm your host, Danielle Young, with my co-host, Wendy Grier. We are rounding out our Resources Month for September with our very own medical director, who is a guest for the second time, Dr. Baugh. Dr. Baugh will be...
Thank you again.
Awesome. Dr. Baugh will actually be bringing us some information on a very important topic that also coincides with the month of September, which is the National Suicide Prevention and Awareness Month. So this is a very interesting conversation, a very necessary conversation, a very important conversation, and we want our listeners to know. But before we get into the in-depth conversation with Dr. Baugh, I'm going to say hi to my co-host. Hey, Wendy, how you doing?
Hey, Danielle, how are you? Hi, Dr. Baugh. Welcome back to the podcast. So excited to have you. It's wonderful to be here again, and thank you for inviting me back. I'm really happy to speak on the topic. It is, as Danielle mentioned, Suicide Prevention and Awareness Month, and even though we are talking a little bit towards the end of the month, I really want to round off a very powerful topic. And I wanted to sort of give people a sense of continuity, that this is an ongoing issue. And, you know, while we recognize it in September, I think we would all agree that suicide will definitely continue to be considered one of the most devastating outcomes that we can experience. And it often impacting, first and foremost, the individual, their family, friends, loved ones, and often the community at large. And this definitely includes those of us who provide treatment. I believe that suicide is a very critical issue that deserves very critical attention. So many lives are touched directly and indirectly by suicide. And I think that being here today, I want to really send the message that it is most important how we respond to the issues of suicide, and know that our responses could not only change the lives, but potentially save a life. And that is really what our goals are today in talking about this. I want to make sure that people are aware that they're not alone, and that experiencing suicide is not a normative way of life.
Absolutely. I think that Dr. Baugh, you did an excellent job in providing a summary as to the importance of our conversation today and the importance of suicide prevention and awareness, and why it needs to be spoken about, because it affects a whole range of people, individuals, families, clinicians, the community as a whole. And people need to know that they've got to start talking about it, because it's just that important.
Truly, I think knowledge is power. And, you know, I think often, no matter what you read, no matter what you're hearing, I think the first things that people present around the topic of suicide are statistics. But I think facts are very powerful. I think that there are a lot of misnomers, there are a lot of myths about the issues and topics of suicide. And, you know, I think it's very important from the get-go to give people a little bit of background, so that you understand that everybody is responsible for the welfare of others where this topic is concerned. You know, over the last 20 years, and a lot of the data we have is probably from like 2019 right now, that in the last 20 years, it remains a leading public health concern. And the statistics are pretty compelling, because 80 to 90% of individuals that do commit suicide do have comorbid mental health disorders. And so we can definitely see that those that we work with, those that we treat, not to mention those we live with and love, all are very, very vulnerable to this topic. You know, suicide at this point is the 10th leading cause of death in the United States. And to put it in perspective, it is the second leading cause of death for those ages 10 to 34. I think that's astounding. I mean, when you think that suicide safety basically holds the same importance as telling your child, look before you cross the street, right? Because essentially it is behind accidental death. It is the second cause of death for children and adolescents. I think that is a huge critical issue for us.
Absolutely. I'm wondering, can people prevent suicide? And what are the signs that you see in your practice?
That is an excellent question. I would have to say, first and foremost, suicide is not a predictable state of being, but it is something that is preventable, and you can take preventive measures to assist those that are suicidal. The approach that I take is early identification equals early intervention. And I think that's going to be really crucial when we talk about assisting those that are suffering, dealing with suicide themselves, or with, loved ones, family members. The first and foremost issue is don't be afraid to ask individuals directly what they're experiencing. And when I say directly, meaning, are they having suicidal ideas? Are they making a plan to end their lives? Or have they recently attempted to do so? These types of questions aren't triggers. I often, by the time you are asking these questions, if folks are intending to do something, that's a decision that they have often already made. The most important thing about asking questions is it gives someone an opportunity to talk about hidden feelings. And it gives you an opportunity to allow them access to getting help. So I'm just going to say that over and over again in our discussion, but it's so important. And I think when it comes to prevention, always thinking safety first. Do not hesitate to seek, or direct someone to professional help. I try to reinforce with everybody, even with those with therapists, doctors, nurse practitioners that are caring. It is not a single person's sole responsibility to keep someone safe if they are suicidal. I think that we'll often see in the community as well that whether for cultural or religious or personal reasons, beliefs, loyalties, that people will attempt to address suicidality in a private forum. That's not the way it works. And often, I think addressing this with people that are, let's say, non-professionals, are an important first point of contact, because sometimes people need a gateway or to feel like they are allowed to talk about things. But beyond that, safe conditions for someone that is suicidal will require oftentimes like 24/7 care, monitoring people at home, and feeling that, I can keep them safe here if I stay home, if I watch, if I monitor. Often, if individuals are intent upon harming themselves, will be quite resourceful. And you can't be awake 24/7. Even in a hospital, they are sending you into an environment where there will be different people on different shifts at different times. There are cameras. So please know that it is no one individual's responsibility when it comes to prevention. People often make contracts and plans. Again, those things are not guaranteed for safety. So feel free to say, go into the emergency room, or I will make calls for you, with you. Very important.
Dr. Baugh, you have just given us so much information, and we've really just started. There are a couple things that have stood out to me just listening to you talk, and I'm taking notes as you talk, because we are also therapists and also work with clients who may at times either have ideation or have spoken of ideation, or maybe have loved ones who have experienced that exact feeling or that exact thought. And the one thing that is driving home for me, and it has been a challenge even as a clinician, you said to not be afraid of asking directly. And sometimes that can be a barrier for those who may see or sense that something is going on with either, again, their loved one or someone they care for, a family, relative, a friend. And sometimes asking directly does feel a little bit invasive because you can see that a person is going through something, but to ask, sometimes even you don't want to know the answer. But you also said at this point, at a point where there is either ideation, or if there's a plan, or if there was action or an attempt, it's not in the trigger realm anymore. This is something that has already been thought out. And so it is good, and it is a much safer way to just ask directly so that we can get to that next step of help. Another thing that you mentioned, and I think this would be another conversation for another day, but it's really good. You said something about different private forms or organizations, or even religion or religiosity. Sometimes you rely heavily on that to get you out of the state of ideation, but there needs to be a stable place, or there needs to be a place of safer conditions. So in addition to prayer, or in addition to those communities, seeking attention, medical attention, going to the hospital oftentimes is the safest place for those who are experiencing ideation. So those two things really stand out. There's another thing that we kind of can go on into the next question. We're moving into the holiday season now. And so I'm wondering, we oftentimes hear that the suicide rate goes up, or the ideation goes up around the holiday season. Is that a myth? I remember last time you did some Mythbusters. Is that a myth, or is there some truth to seeing spikes of ideation during the holiday season?
Danielle, that is a wonderful question, because I have to tell you that it is indeed a myth that suicide risk is greatest during the holidays. As a matter of fact, suicide really occurs most often during the spring and summer months. And if you think of it the way you sometimes parallel suicidal ideation and suicide attempts in depression, often individuals won't have the energy to actually make attempts and make plans during the deepest, darkest time of your depression. But then as your energy, as you begin to get better and your energy grows, it is at that time that often people notice that there is a greater inclination for people to act on suicidal thoughts. And it seems counterintuitive, because you would think, when I'm really at my darkest and saddest, I am going to act. But in reality, when people are just starting to feel a little bit better, that apathy, that lethargy decreases. And then you do find that a lot of people will actually make active attempts to harm or end their lives. And the same way that goes for seasons, that really often in the winter months, during the peak of when you're really sad, often people don't even feel like they have the energy to do that. And then as we lead into warmer weather, when people are out and about and there's greater energy, that happens to be when people will often make attempts to end their lives. So that's just an excellent question. Excellent.
I think too, it sounds like, people believe that, when someone's coming out of the winter months, when it's very dark and it's very sad, that, oh, they're chipper. They're not even thinking about anything. And that's a big misnomer, that even in the spring and summer, those feelings of despair and sadness and depression carry forward. And it's never out of thought that they're thinking, I'm going to maybe hurt myself or do something. So that's a really, really good point to make.
And it is just excellent. And I think that both of you have brought up, the issue of asking questions and talking. And I think that it is really important in also building that trust relationship when you are asking folks questions so that they do feel free to answer, because we are really heavily reliant on someone trusting us enough to share that information, especially because if on the outside, if externally you look as though you're feeling better and you're out and you're about, there really are not always these telltale signs to let us know that you're in trouble. So, I just keep talking a little bit about, being receptive, listening, trying to be non-judgmental when individuals are sharing with us.
And just before we move on to our next topic of conversation, a couple of times in the different episodes that we've had, we've even brought up the dynamic of Hollywood or even actors. And, this kind of falls in line with what you say, those who entertain us, sometimes we don't know or we don't see the sadness or the depression or the anxiety. And then we have a news headline about an actor, and we didn't even know that they were suffering from depression or anxiety, or we didn't know that during those times, maybe just coming out of the holidays, because they've entertained all season, that now that everyone's gone, it makes sense that after this winter season, maybe you're experiencing it, but it's the action that happens maybe following that when things come down. So thank you for sharing that. And, for our audience, of course, we have the clinical side of things, but to make it into layman's terms, especially if we have younger audience members that are listening, we can look and we can reflect on even those younger Hollywood stars who've made certain attempts, and you never think like, wow, we just saw them on Instagram. We just saw them on TikTok. We just saw them on social media. Things seem to be okay, and they really aren't. So, Dr. Baugh, you're providing us with so much information today. Wendy, what are your thoughts before we move on?
I think I want to just piggyback on what you said. We saw it play out in women's professional sports and some men as well this summer who are bringing awareness to depression and the importance of taking care of one's mental health. And so I applaud them, because now they're using their platform to reach our younger audience members that follow them on social media and that are, they're brave enough now to start talking about it. So that's a very good way to affect prevention and get people more aware. So absolutely important conversations we are having. So Dr. Baugh, before we get into discussion of types of treatment for depression, I want to go back to the question that we asked you earlier when you spoke that suicide is not predictable event. However, are there signs that people should pay attention to?
I think that's a great question, because I do believe that often people will try to pigeonhole what someone that is suicidal would be like. And really, I try to say that there is no specific profile. There are, though, risk factors, and then there are some important signs that often we overlook or sometimes ignore. And, of the risk factors, I take a look and consider risk factors to sort of be like conditions that might impact how likely someone is to attempt suicide. I think, for example, a really important factor to consider is previous suicide attempts. If an individual has actually attempted suicide previously, we definitely have identified that as the most powerful predictor that we do have. And in addition, there are a couple of things that I think people should look out for. Substance abuse is also, I think, secondly, one of the most influential factors for those who have attempted or completed suicide. Up to 40% of people that abuse alcohol will actually attempt suicide. And we do find that when many people are experiencing other mental health disorders, comorbid use of substances or alcohol are very often a very important aspect of suicide. So definitely something to be considered. A history of suicide in families, close relationships tend to be another important factor. Often hearing people talking about feeling like they're a burden to others, feeling that they are worthless, and very importantly, talking about feeling as though they're trapped and they don't have a way out. It's very important for people to understand that they are not alone and that we are here to help facilitate getting them the help and support that they need. And as far as signs, which are sort of changes in the behaviors, there are often very abrupt changes in mood and behavior that might be a signal to us that an individual is indeed experiencing suicidal thoughts. Often people will talk about it, post about it, journal. And if we are noticing these kinds of changes in behaviors, that should be a red flag. You'll often see that people might be a bit more reckless or start giving away prized possessions. These are definitely things to, once again, draw attention to. Is this person in distress? What's going on? And very often you may see sort of depressive symptoms where people are more withdrawn, may no longer care for themselves. So again, these are all very different things, and there's not any one profile, and sometimes you have to bring it into context with what's going on with that person. But do look out for some abrupt changes in behavior and mood.
Okay, thank you, Dr. Baugh. And I know we had you on back in the month of July to discuss how medication can be a part of self-care. And I know with clients who suffer from depression, medication is often used as part of treatment. Are there any other things that happen with clients suffering from this disorder?
Yes, I think that very importantly, and you both brought up, during the course of our talk today, what some of the tools are that people utilize, such as their religious faith, to help bring them through some of the really difficult times. And so it is important to urge people to utilize those strongholds, those anchors in their lives, to continue to grow and to continue to find coping skills that are going to be effective for them. Suicide is not necessarily a lifetime label. It is often not even a lifetime event. Once suicidal, always suicidal is a huge myth. Very often it is only for that period of time that an individual is experiencing something. So do know that being able to work on lifestyle changes and self-care, exercise, healthy eating, good sleep hygiene, working on your personal and spiritual growth. Again, I think every time we talk, we will touch on that self-care as being like a really important part in reinforcing health and happiness. And of course, therapy, because the coping skills that we talk of beyond our personal experiences are important, because very often people do attempt to hold on to their personal anchors, and it may not be enough. So utilizing new and different methods to deal with stress and ongoing difficulties and challenges in your life are really important. So I do want to stress that therapy is a core piece along with the medication management in treating depression. Very important.
Mm-hmm. Mm-hmm. Thank you, Dr. Baugh. What I'd just like to do for our audience before we move on and to our last question to wrap up, I just wanted to kind of highlight those risk factors again, but also highlight some of those things that could help or that could increase functionality over time. So the risk factors include any types of previous attempts of suicide, which you did say is the most powerful risk factor. But also if we notice depressive symptoms, substance abuse that has a comorbidity. So if there's alcohol and maybe drug abuse, or even sometimes prescription drug abuse, I could imagine abrupt changes in behavior, and then also talks about it or posting about it. Again, going back to this age of social media, especially for our younger audience, if you see something, say something, especially if there's a post about it or if there are pictures about it, if there's reckless behavior, and also this interesting phenomena of giving things away that are prized possessions. Something that was so valuable before has no value now, so giving those things away. But just like there are risk factors, there are ways to increase coping skills and healthy functionality. And so Dr. Baugh talked to us about the two top tiers, I would say, especially for this podcast, is therapy and medication management, and making sure that an individual is actively seeking those things and following those things. In addition, good sleep, healthy eating, and that self-care aspect that we spoke about the last time that you were here. Also, making sure that you are mentally, emotionally, and physically in a good space. So if that means changing lifestyle to whether it's exercising or taking walks, or, it could even include some type of artistic activities that you implement into your day. So these are things that we want our audience to understand, the signs to see, the risk factors to see, but also to help those increase their functionality to manage stress and also decrease the likelihood that ideation will happen again, because as you've already said, this is not a lifetime label, and that this could have just been in a period of time, but it takes a multifaceted approach to getting one back to functionality. So thank you so much, Dr. Baugh, for that. I just wanted to make sure that we highlighted that for our audience. And before we go, Dr. Baugh, we also want to be able to leave on a positive note. Is there anything that you could give as far as positive tips for our audience to continue to promote prevention and awareness? Because we are in this time of crisis and we're in this time of trauma, we're in, COVID-19 times, and we're not quite sure how we're going to exit it. But with this information that you've provided for us today, can you give our audience a positive outlook, tips to promote prevention and awareness?
I would say that in essence, I would summarize things we've touched on today. And I would say first and foremost that because as I said earlier, once someone is suicidal, not always suicidal, it is really important to understand how great an impact you can have on someone's life, not just in that moment, but you have the potential to provide a lifetime of joy for people in your intervention. So do understand, don't be afraid to ask questions. Don't be afraid to be direct in those questions. In terms of engendering trust, be receptive, listen, stay calm, stay as non-judgmental as you humanly can to help reassure someone that in sharing what it could be a life-altering secret or thought is being placed in caring hands and where people can feel that they can be helped. And most importantly, if you hear and see something, say something. Avoid being sworn to secrecy, and yet don't feel compelled that you are the only answer. Mm-hmm. Know that if they can trust you, you are sort of the conduit to finding other more accessible and certainly often well-informed avenues for help. And, I want to round off with saying that things like Suicide Prevention Lifeline, the National Alliance for Mental Illness are great sources, not just statewide, but across the country, that allow people to either make phone calls, 1-800-273-TALK, or if people are not feeling comfortable to have direct discussion and access, they can look up the NAMI website and again, the National Alliance on Mental Illness, and they can look things up in terms of accessing. once again, I think that this is just a wonderful avenue that you all are providing in helping people know that there are people and places where they can reach out.
Wow. Thank you, Dr. Baugh, so much for just allowing us to be educated on such an important topic, a topic sometimes that is very hard to approach, but we want to be able to open the dialogue. So Wendy, can you round us out with your last thoughts and then let our audience know what's coming up next for the month of October?
Sure. I think this conversation by far most important we've had, and I know that it will resonate with our audience members. I think my final thought is suicide doesn't have to be a lifetime label or an event. And I think members need to know that, audience members need to know that asking and being direct brings awareness and helps prevent. And I think that is the key. And I'm going to leave it there for our audience. Coming up in the month of October, we have another series on community resources with more guests to come and discuss what's out there for our audience in terms of help, information, and knowledge. So excited to continue on with this series.
Absolutely, and that is what we are all about. We want to thank our medical director, Dr. Leslie Baugh, for bringing us to another level of awareness and providing education on suicide awareness and prevention. My name is Danielle Young with my co-host, Wendy Grier, where we're striving to make a difference in mental health. We will see you next time.